and you just cannot conceive after 1 year of trying, you just might be having infertility and excessive alcohol intake. J5. Hi guys, welcome back to my YouTube channel. I'm Dr. Hilda and my YouTube channel is about health and lifestyle. If it's your first time stopping by, thank you so much for stopping by. I hope you enjoy my content so much that you consider subscribing. And if it's not your first time, thank you so much for always coming back. I really appreciate your membership in my community. I know that sounded so deep, but it's really deep for me. So in today's video, I'll talk to you about infertility, the various causes of infertility in males and females, and how these various causes can be treated. If this is something you want to learn, just sit back and come on this journey with me. So infertility is inability to conceive despite regular sexual intercourse after a period of 1 year. Take note that I said regular intercourse, and also take note that I said after 1 year. So I know you'll be asking yourself, what's regular sexual intercourse? So an interval of 3 to 4 times a week is optimal for pregnancy to occur. So it's really disheartening that in a society where we live in, females are always the first to be dragged, to be insulted, or to be blamed for the cause of infertility. The sad thing is that it's always women trying to put down women. You see your mother-in-law trying to drag you, your sister-in-law trying to drag you, and the rest of that. Interestingly, both males and females can have factors that can lead to infertility. 30% of infertility comes from the male factor, and another 30% comes from the female factor, and the last 30% comes from both factors as mixed factors. So we see that it's not just women that can have infertility problems. So let's just be educated and educate those who actually need to know about this. So at this point, let me take you through a quick journey so that you understand the various causes before I list them. So for pregnancy to occur, there has to be sexual intercourse first off, and with sexual intercourse, ejaculation occurs, and this ejaculation contains sperm cells. Now let's look at the female. First off, she has to ovulate, and ovulation simply means the release of egg or ovum from the ovary. So this egg that's released from the ovary is going to be transferred from the ovary through the fallopian tubes to the uterus, and on their way they're going to be fertilized. So when it gets to the uterus, they are implanted and pregnancy is said to have occurred, and the baby just grows and grows and grows until they come out after 9 months. Easy, right? Yeah. So anything that's going to affect any of these processes at any point is going to cause infertility. If there's a problem with ovulation, you will have infertility. If there's a problem with transfer, that's the fallopian tubes, if they are blocked, you have infertility. If there's a problem with the uterus, there's fibrosis, adhesions, and implantation cannot occur, or there are fibroids in the uterus, infertility will also occur. Let's look at the males now. If there's any problem with ejaculation, maybe they have retrograde ejaculation, instead of the outward ejaculation of the semen during sexual intercourse, it goes back in, it will cause infertility. If there's anything that causes erectile dysfunction, you guys, if you've not seen my erectile dysfunction video, please, I'll just leave a card, just watch it, okay, if that's something you want to know. So if there's anything that would affect these sperm cells in their number, if it is a reduced number, that's the sperm cell count, or the sperm cells are present but they are abnormally shaped, or they are very weak, they're not moving so fast, because when ejaculation occurs during sexual intercourse, these sperm cells swim very fast towards the egg, and so if the sperm cells are not moving so fast and they are very slow, infertility can also occur. So let's just look at some specific causes of infertility. So first of all, let's talk about these two bad guys that are always present in almost every disease: smoking and excessive alcohol intake. So if it's something that you practice and experiencing infertility, you can see that you should actually stop. And if you're not even experiencing infertility but you practice all these things, you now understand, or you have a clearer picture that it can actually affect you in future. So let's look at the female now. If she has anovulation, that's problems with ovulating, that's the release of the egg from the ovary, diseases like polycystic ovarian syndrome, that's a topic that deserves a full video. Just let me know in the comments if I should make a full video on that, and I will do it gladly. So if a woman has polycystic ovarian syndrome or premature ovarian failure, okay, I know you wonder what's premature ovarian failure. So we know that as women age, they attain menopause. So when a woman attains menopause, she's unable to ovulate, and she's not up to the age of menopause. She's premenopausal in age, and she's experiencing ovarian failure. There's no ovulation. So let's look at some causes that can affect the fallopian tubes. If you have blocked fallopian tube, you guys really need to listen to this. People keep having multiple unprotected sexual intercourse. So you have multiple sexual intercourse and now have sexually transmitted infections, and instead of you to go to the hospital and be treated properly, you go to a roadside chemist or you just buy medications by yourself and take. This infection is going to be occurring and reoccurring and become chronic, and it can lead to blocked tubes. So when the tubes are blocked, these eggs that are released from the ovary will not be able to be moved or transferred from the ovary to the uterus. So let's look at the uterus. If you have conditions like fibroids, especially fibroids that occur underneath the endometrium, that's submucosal fibroids, it can lead to infertility. If you have endometriosis, this is a condition where endometrial tissue is found outside the endometrial cavity, that's outside the uterine cavity, can also lead to infertility. You guys, I simply cannot just exhaust all the causes of infertility in these particular videos, but these are the common causes. We also have congenital anomalies and some genetic diseases causing infertility. In males, anything that's going to cause erectile dysfunction, affect ovulation, or reduce sperm count like smoking and the rest of that would cause infertility in males. As if you're experiencing infertility, you're having regular sexual intercourse, and you just cannot conceive after 1 year of trying, you just might be having infertility, it's important that you go to a hospital. The doctor is going to order a series of tests, examine you and the rest of that. For females, you will have a scan, you'll be checked for any infection, you will have a scan to rule out fibroids, and also outline your tubes to see the particular cause. For men, you will have a semen analysis done to check your sperm count and the rest of that. So let me just move on to the various treatment options for infertility. So first off, in trying to treat infertility, the age of the couple has to be addressed. It plays a very important role in the treatment of infertility. Also, the cause has to be addressed. So let's start with the woman. If she has problem ovulating, she can be placed on medications to cause ovulation induction so that the eggs will be released from the ovary. And this can only occur if she's pre-menopausal, that's if she has not attained menopause, because we know that as the woman is getting old, the ovarian reserve actually depletes. It's also very important that if you're experiencing infertility, you understand your cycle, understand your menstrual cycle very well. You know when you're fertile, so you have a timed intercourse. So you time your intercourse around the fertile period to increase your chances of getting pregnant. If the woman has conditions like fibroids, Asherman syndrome, where there's severe adhesions, or when she has fibroids, removal of the fibroids can be done surgically. Men that have low sperm counts benefit from medications that can increase their sperm count. Everybody benefits from losing weight. If you're on the big side, if you take a lot of alcohol, you cut down on alcohol and stop smoking if you practice smoking. Other advanced procedures like intrauterine insemination of semen can be done. This is very beneficial, especially in unknown causes of infertility or where the man has low sperm count, so that the sperm cells can actually be selected and introduced into the uterus. There's also room for assisted reproductive technology like the IVF, which is actually very common. So in this instance, the woman actually undergoes ovulation induction, and when she has actually ovulated, these eggs will be harvested and sperm cells will be used to fertilize the egg outside the woman's body. And after fertilization has occurred, this embryo will now be transferred into the uterus and allowed for implantation, and hence pregnancy occurs and she can actually have a baby. So before I go off, I'll just quickly like to drop some tips that can improve fertility. So first of all, it's important that we practice healthy lifestyle. So before I run off, I'll just like to drop some tips to improve fertility and prevent infertility. So it's important that we practice healthy practices. So it's important that we carry out healthy lifestyle practices like cutting down smoking, exercising, having a balanced diet, a nutritional diet, highly nutritional diet with fruits and vegetables. Try to avoid toxins like pesticides. It's very important that women actually understand their menstrual cycle. It's very important to understand your menstrual cycle. You know your fertile period, so you can actually know when to have sexual intercourse to improve your chances of getting pregnant. If you have any questions or suggestions on videos you'd like to see, kindly leave them in the comments and I'll be glad to address them. Thank you so much for watching, and I'll see you in my next video. Bye.
Go, 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 go.